Phantom pain can be described as generalized sensation in the missing limb. It's oftentimes described as painful or unpleasant. It can happen immediately after the amputation or years later. Over 70% of patients who have had an amputation say they have experienced phantom pain in some form or fashion post amputation. What's going on during this time is it's all happening in the brain. The brain is attempting to reorganize the nerves and some of the nervous system that are affected by the missing limb and that were damaged by the missing limb. The brain is trying to figure out the changes in perception and nervous system from the nerves that are missing from the amputation. A lot of times, what you can expect to feel may be dependent patient to patient. Like I said, over 70% of patients have experienced this. You could experience things such as cramping, itching, burning. Some people describe it as shooting pain, an unitchable itch, and just generalized discomfort. With the amount of patients post amputation experiencing this sort of pain, there have been a lot of strides in researching ways to help alleviate some of this pain. Some of the more common treatments for this is a nerve block in that area where you're feeling the sensation. You can also use what we use in physical therapy, which is called a TENS unit. It's sending electrical stimulation and current through that area to kind of help relieve and kind of help loosen up some of those muscles. But what's becoming more of a treatment option and more recognized is what's called mirror therapy. And what that is you would put a mirror, a box mirror in between the missing limb and the unaffected limb. So with that, you would be looking at the mirror and you would move the unaffected limb through various motions, range of motion activities, and through artificial visual feedback, you seeing the unaffected limb move mirrors the image over to the missing limb. So your brain can see two limbs moving at the same time, and you can kind of help loosen some of the tension that you're feeling or alleviate some of the pain that the phantom limb is presenting at that time. Another big component or treatment that you can try is meditation and relaxation. If you try to imagine that limb is relaxed and you try to meditate and quiet the brain's activities, that can help too. And those are just a few treatments and a quick background about phantom pain.